On May 10th, 2013, my husband called me from the field. He was out discing so he could plant soybeans. And he called me and said, I think you and our son better come and get me. I think I'm having a heart attack. So he was 2 miles away from us, and I hopped in the van and we went flying over there. On the way, I called the clinic in Clark, and it was Friday afternoon, 3:30. I just wanted to make sure that she was there, and I told them I think Mark's having a heart attack. So they knew before I got to him. Once I got out to the field, he climbs out of the tractor, leaves it running, and says, "Don't worry, I think it was just gas. I burped and I feel a lot better." And my son and I looked at each other and we were just like, I couldn't believe he said that. He looked horrible. I didn't know then what it was. He was a grayish, greenish color. And I said, "Get in the van." And he's like, I am not going to Watertown to the hospital. I said, "You are going to Clark now." So he gets in the tractor, shuts it off, moseys over to the van, and we start going down the road. We made it 5 miles, and he just very quietly grabbed his chest and went, "I'm not going to make it. You better call 911. So while I'm driving down the gravel road, I call 911 and told them we were headed to Clark. Send the ambulance on the highway south. And of course they asked, "What highway?" And I was like, "It's the only highway." Just send them. They'll know. And so then she hung up and I kept driving down the road. And she calls back and she says, "Okay, they're on their way. Where are you?" And I said, "I'm 12 miles south of Clark right now." And "What are you driving?" she wanted to know. And so I explained the van. And my husband just calmly leans over and turns on the flashers. Good idea. Excellent. I would have thought of that. And so we went flying down the road. I asked him if I could speed now. And so he was like, "Yeah, it isn't going to matter." And he was very quietly sitting over there, just struggling to breathe. He was working so hard to get air in. And we met up with the ambulance about 5 miles south of Clark, and I get out thinking I'm going to go around and get him out, or have the ambulance driver help. And he gets out of the van and walks over to the ambulance. He just looked like a feather, just wobbling as he just staggered over there. Later I asked him, "Why did you get out of the van?" And he said, "Well, I thought you and Ben would feel bad if I died in the van." I said, "Pretty sure we would feel bad no matter where you died." But that's what he was concerned about, us. Well, then I didn't realize, but Clark had called Watertown right away as soon as there's a cardiac arrest. And Watertown ambulance was already closer to us than we had been to the Clark ambulance, because we only made it maybe 4 or 5 miles east of Clark, and we met up with the Watertown ambulance. And so they pull off to the side of the road and they swing the doors open on the back of the van, or the ambulance, and nothing happens. We just sit there. They never took him out, and we just waited. And I finally couldn't take it anymore, and I got out and I walked over to the side of the ambulance. They had the side door open, and I climbed in to talk to Mark, see how he was. And we saw him just take 3 breaths, and then he stopped. And they politely threw us out of the ambulance. They had work to do. And so I just stood there on the side of the highway. And that was the first time I started to get upset and cried and cried and cried. And I know it didn't take very long, but it seemed like a very long time on the side of the highway. And finally, one of the drivers hopped out and said, "Get in your van, we're leaving." And so we took off. And I couldn't keep up with the ambulance. They had to have been going 95 miles an hour. They went flying up to Watertown. And I followed. I could keep them in sight, but I couldn't drive that fast. And when we got here, I got to him before they even got him out of the ambulance. I parked and ran over there. And by that time he was awake. He was aware of where he was. I guess he had talked to the ambulance driver about when they hit city limits. He came to. But he was blue. And then that's when I realized he wasn't getting enough oxygen on our way to Watertown. And they whisked him off as running down the hall and took us to a waiting room. And the ambulance EMT came and talked to me in the waiting room, and he said that it was really tough, but they got him revived. And he said, in 3 days, he'll walk out of here. And I just was like, are you serious? Don't worry, Dr. Garcia will have him walking out of here in 3 days. And 3 days later, we took him home. And he wasn't ever going to go through that again. That was one thing he told me. I don't care what I have to do. I will never do that again. And so he is doing absolutely wonderful now. He exercises. He eats right. He had his stress test at 6 months. And they said he passed it with flying colors, that it was absolutely perfect. And so you can come back from a really bad heart attack. I didn't realize when they wheel you into the emergency room, they actually have a clock that starts. And from the time that Mark got into the hospital till the time that that artery was open was 11 minutes. It just doesn't seem possible. But he just went flying in. Dr. Garcia knew he was coming. The catheter lab was not being used, so they could take him straight from the ambulance into there. And Dr. Garcia did his job. And then Dr. Garcia came and talked to us the very first day and wanted to know, what might have brought this on. Do you smoke? And my husband was a smoker. And I had seen him struggle and try to stop for 20 years. And I guess a heart attack is a really good stimulant because he's doing wonderful with that. And make sure that that you exercise. And my husband was like, I do work around the farm all the time. I'm in and out of the house and down to the shop and in and out of tractors. But that isn't the exercise his heart needed. He needs to be active for 15 to 20 minutes and get his heart rate up and keep it there while he's exercising. And that's what he was not doing. He was active, but he wasn't exercising his heart. And then, he's on medications he takes morning and night, but they obviously are working because his cholesterol and his blood pressure are all wonderful, they said. And so he said if that's all he has to do is take a few pills, he's willing to do that. I had been trying for 2 years to get Mark to go to the doctor because I kept telling him, it's your heart. You have to quit smoking. It's your heart. You blame everything on those cigarettes. It is not. Well, I could see he was slowing down. When he walked across the yard, he looked like an old man. He walked slow. He just wasn't his normal self. I mean, I couldn't keep up with how fast he used to walk across the yard. He just lost that quickness. He was tired. He couldn't lift things and work for, 15, 20 minutes, doing something without getting out of breath or being tired. And he said, well, I'm getting old. I'm old. Well, he was 57 when he had his heart attack. And I think now he's better than he was before the heart attack because he's not out of breath. And what would I advise a wife? I always felt that it was Mark's business. If he didn't want to go to the doctor, I shouldn't be telling him because I don't want somebody telling me. Don't take that advice. I should not have let him go 2 years. I should have made the appointment and made him go in because he was afraid if I go, they'll find something wrong. Don't wait until that something wrong is that serious. The best thing about the cardiology program down here, I would say, is Dr. Garcia. He is a wonderful man, and Mark and I just can't thank him enough for what he's done for us and for other people. And everywhere Mark goes, whether he's with his hunting buddies, he will tell them about the cardiology program here and tell them, you don't have to go to Sioux Falls. You can go to Watertown. We've had people call and say, who did you talk to in Watertown? And want to get the phone number and come down here and see him. Mark talks to people, when they ask him how he's doing, and he'll say, just don't wait, like I did. Get in there. It's actually easier if you get there before the heart attack and have to have them do the procedure in the catheter lab rather than do it in the middle of a heart attack. But Mark and I tell people all the time that this is just a wonderful program. It saves lives.